Welcome. This is, my name is Andy Miller. I'm Atlanta chapter president of the Association of Healthcare Journalists. We're co-sponsoring this event on health reform, along with the Alliance for Health Reform. And we welcome you here, and we hope to have a lively interchange on this very complicated topic. Hopefully we can make it as simple to understand as we can, although that's going to be a challenge. We start talking about accountable care organizations, I think we're going to lose everybody. But anyway, welcome, and I'm going to turn it over to Ed.
Oh, thanks, Andy. I am Ed Howard, just like it says on the sign. I'm with the Alliance for Health Reform. Let me just say the 90-second, the Reader's Digest version of what the Alliance for Health Reform is, if I can. It grew out of the ashes of the Pepper Commission we were just talking about, which was supposed to solve all of our healthcare problems 22 years ago. And we almost got there, but here we are. And what came out of it was an awareness of how little the policymakers really knew about this complicated subject. In fact, Jay Rockefeller, who chaired the Pepper Commission and co-founded the Alliance, said that 2/3 of his Senate colleagues didn't know the difference between Medicare and Medicaid. Now, you'll all be pleased to know that a couple of years ago, as a way of illustrating that the Alliance had done some good work, he asserted that 2/3 of his Senate colleagues do now know the difference between Medicare and Medicaid. But since then, we've been doing seminars for members of Congress, mostly for their staffs, for reporters, for people in the health policy community, excuse me, mostly in DC, but occasionally they let us out of our cages to do things like this. We are aggressively bipartisan. We have, except for the last few months, had both a Democrat and a Republican in our honorary leadership. We do briefings, 20 or 25 of them a year in DC. We do publications, a source book for reporters that I think all of you have had access to through the association. And we're in business in part to make sure that you're able to tell the story as well as you can. And that's part of why we're here today. There is one thing in the package that I want to call your attention to. It's a sheet that describes our Find an Expert service, which is an online way to connect with 500 or 600 folks who have pre-sorted themselves so that you can find somebody who is west of the Mississippi, speaks Spanish, and has B-roll, if that's what you want. And if you haven't signed up yet, we'd encourage you to do that. I want to also make sure that you know Bill Irwin, who's behind the camera at the moment, but is also our communications director. He is a former reporter. He is somebody who knows his way around the health policy community, and he is anxious to be able to be helpful to any of you in your work as you go ahead, whether it's talking through a story idea or looking for a source that you don't have time to do yourself. Let me just say thanks to Andy and the Association of Healthcare Journalists for allowing us to be part of this series. It's an important extension of our work. Also thanks to the Robert Wood Johnson Foundation that allows us to be able to support these briefings in 6 or 7 cities around the country. This is the beta, so we're going to learn from the way it turns out here, and you'll be able to see a video of this. That's what Bill is involved in just a couple of weeks on the Association for Healthcare Journalists website, also on our website, the Alliance for Health Reform, which is allhealth.org. And we'd love to get your feedback about that. In DC these days, everybody's sort of doing a Howie Mandel impersonation, you know, deal or no deal. They're all talking about the super committee and what's going to happen, and it is a big deal. But with or without it, and whether it's a big or a minimal or a non-existent deal, the Patient Protection and Affordable Care Act, the ACA we call it, is going to remain law at least until the Supreme Court or a new Congress and president say something different. And that's what brings us here. Under that law, states have countless opportunities and obligations, and our main focus tonight is to give you a chance to hear from some real health policy experts about that process and anything else you'd like to ask them about. I'm not going to do them justice in the introductions. There are biographical sheets in your packets, but they're both people you either know or have heard of, or both. Deborah Chalet is a senior researcher at the Mathematica Policy Research Institution in Washington, D.C. She is running health policy projects and has run health policy projects in more states than I can count. She has held faculty positions both at Temple and at, coincidentally, Georgia State. And she will be followed by Bill Custer, who is an associate professor at Georgia State and head of its Center for Health Services Research, and is an expert on the health care delivery system, on insurance, and on some of the things that have been going on right here in Georgia. So without spending any more time in preliminaries, let me turn it over to Deborah for a brief set of remarks, and after Bill finishes his, we'll open it up for your questions.
Okay, thank you, Ed.